Welcome back to Made for More. I am your host, Holly J. Moore. This is a show where every single episode we give you a tool, at least one tool, to help you show up as the best version of yourself in your life, because we want you to absolutely thrive, not just survive. Isn't that right, Aaron?
That's absolutely right. And I know we have a cosmetic surgeon in the house wearing the suit that I was going to wear. So I'm glad mine was in the cleaners. But it reminded me, as we talked about kind of setting up, like, what are we going to talk about in this first episode?
Yes.
So the only cosmetic surgery I have considered, well, I did get my sinuses kind of cleared out, ear, nose, and throat doctor, who's also a cosmetic surgeon. And he's like, well, you know what? I could fix that nose. And I probably should have said yes. But the only other one was, you see these ears? Take off your headphones. You see these ears?
Yes, I see
Same
those.
size since age 8. And my mom is like, you know what, Dumbo, if you want them pinned when you're 18, we'll take care of that. And by that point, I had grown into them.
Yes.
So, but that's the only thing that I really ever considered.
Okay.
But then now I'm a dad of 3 daughters now by marriage.
Yes.
And it's the whole kind of fixing things.
Yes.
It's a thing. It's a topic, and I'm grappling with it as a dad, as a daughter dad.
Yes.
A girl dad. That's how we say it, girl dad.
Yes, it is a thing. I won't tell you how many cosmetic procedures I've considered or had done.
Nor will I ask.
Thank you. But I have to ask, so did the ears bother you growing up?
Oh, absolutely. They were flicked. They were, I mean, because they're so far away from my head, they lost circulation. So there were times I couldn't hear. There were times, no, they absolutely bothered me. Yeah.
Okay.
I mean, it was enough that my mom was like, if you want them pinned back, little Doberman, then we could do that, but you got to be 18.
Yeah. Okay.
But I didn't do it by that time. I was grown into them.
Yeah. Well, I will tell you, one of the things I think about a lot, because I'm a mom too. I'm a girl mom. And I always think, how do you approach this with kids? Yeah. And I'm going to ask Dr. P what she thinks about that.
That's Dr. Christina Pantazopoulos. Yes. Pantazopoulos? I said it right?
Yes.
Oh, yes, I did.
I just go with Dr. P. I am here today with Dr. P. She is a board-certified orthopedic surgeon who has transitioned to cosmetic surgery and is the founder of Manhattan Beauty Project. Dr. P, thank you for being here.
Thank you so much for having me. I'm so excited.
I teased on my Instagram stories. I'm like, I am talking to a hot surgeon. But funny enough, I think people thought that I was talking about a male.
Well, that is typical.
I know, that's what makes you even hotter though, right? Like,
thank you. Because when you hear doctor, you're automatically think of an old white guy.
Totally. Yeah. Yes. You don't think of like a young hottie.
Well, thank you so much.
You're welcome.
Takes lots of work.
Yes. So speaking of that work, so you used to be an orthopedic surgeon. And I mean, you still are.
I still am.
You still are. I've seen, video of you on Instagram, like rebuilding an ankle and doing all sorts of crazy things.
So it's kind of interesting and odd how that transition happened, because it doesn't usually happen for a board certified orthopedic surgeon to go to the cosmetic world and aesthetics. So it happened kind of organically. I was in a hospital-based practice and we were doing a lot of trauma surgery, and it was very hectic, very busy. And I wanted to do something that was fun. And different, to bring some joy into my life and have happy patients.
Okay.
So the way it went about it is I have a best friend that's a dermatologist and one that's a plastic surgeon, and they mentored me. And I just started doing it really, too bad you didn't know me then, for free.
Oh yeah. That would have saved me so much money. I mean, not that I've had anything done.
No, you're a natural beauty.
Yes. I wake up like this.
Yes, you do. I don't though. So, and then it organically just became more and more part of my life, especially when 2020 hit. Because we were on lockdown and we weren't allowed to do any elective procedures. Yeah. So I was bored.
Oh, Okay.
And then when they allowed us to open, still elective procedures were no.
Yeah.
So then I decided to open a place.
Yes.
And I did it once a week.
Okay.
And then I started charging people.
Yeah.
Because I had to pay for the rent and the lights.
Right.
So, and then it organically just became busier and more a part of my life because it brought me so much joy to bring joy to people's lives. Even though I was able to help people walk again and do all these things with orthopedics, it was just you're seeing people in a very dark time of their life. So after doing it for so many years, over 10 years, I was like, it's taxing.
Yeah.
And it was taking a lot of time away from my home life because I was on call and all that stuff. So it just became a smoother transition. And then eventually it became to the point where I just couldn't do both and give all of myself to either field. So I've decided since last year to completely put myself into Manhattan Beauty Project and help that grow. Okay. And I do miss doing doing orthopedic surgery rather. Yeah. For instance, my husband still does it and he'll send me photos of like this fractured femur and he's like, oh, I'm going in to do this cool case. And I'm like, oh, I wish I could still do that. So what I'm going to do to fill that void is do mission work.
Oh, okay.
Yeah.
Wow.
There's a mission in Kenya in the fall that I'll probably be going to.
Oh my gosh, that's amazing.
With Dr. Loretta Chu, who's a chief at Stanford.
Okay. Wow.
Yeah.
So now you're completely like invested yourself into Manhattan Beauty Project, which is just, aesthetics, right? So what are the effects that you see of your patients? Well, actually, let's back up a little bit. Okay. So tell us, what kind of procedures do you do?
So I started first doing injectables, all the common known fillers, Botox, threads, and then I transitioned because I am a surgeon and I was missing that part, transitioned to being mentored by 2 plastic surgeons on liposuction fat transfers. Okay. So that fulfilled my desire to cut and...
That's interesting. I mean, I guess I have a desire to like litigate. I guess a surgeon has a desire to cut.
Yes, like cut and fix and have that immediate gratification is what I look for. I'm not interested in maintaining your blood pressure and figuring out which medication and let's try this one and let's see. No.
And you also do BBLs, right?
Yes, I do.
Junk in the trunk.
That's right. It's one of like the most popular procedures.
Okay, that's what I was going to ask you so what is the most popular thing?
Well, thanks to the Kardashians, it has become one of the most popular requested procedures. Okay. It is a procedure you want to be careful who you go to because it is one of the most dangerous procedures.
I know, that's what I've heard.
There is about a 30 to 40% mortality rate with them. However, if you go to someone that is in the U.S. and practices along the American Academy of Plastic Surgery guidelines, you should be most definitely okay. I mean, there's chances for little things and risk of anesthesia. However, overall risk should be greatly reduced.
Okay. And I feel like you do some other stuff too, like hair restoration stuff, skin stuff,
so we've become more of a whole body, all-inclusive with hair restoration. Yeah. We're doing laser hair removal, laser resurfacing, and just really looking into how to rejuvenate our patients. Yeah. And more towards the wellness aspect and rejuvenation with joint injections with stem cells, PRP, and focusing more on rejuvenating, not just putting Band-Aids on things and doing a steroid injection.
Right. So what are the effects that you see with your patients, like when after you treat them with one of these like procedures?
It is so gratifying when you have a patient. I have a lot of first-time patients that are going through divorce, which is kind of interesting because you deal with that's your clientele. And they're just kind of middle-aged to upper middle-aged women who feel like they've sacrificed so much and given to their family, and now they're out on their own, and they're now have time to look at themselves, and they don't feel good.
Right.
So when they come into me for the first time, I guide them through the process. I'm conservative. I don't tell people like, hey, you need this, this, and that. I let them tell me what bothers them. And then to see their face when we're done, and we've had patients where they're crying because they haven't felt so good in so long.
Yeah.
And to give them that confidence to go out there and be out there again in the real world, go in the dating pool, or just some women have been housewives the whole time and now they're going to the working world.
Right.
So to give someone that confidence, it's so gratifying.
Yeah. So, I don't think we've talked about this before, but like something like 65% of women within 18 months of getting separated and being involved in a divorce go for some sort of cosmetic surgery. But you got to start doing boobs, because I feel like most of them want boobs.
I agree.
Yeah. Okay. Let's get boobs on the roster for you.
Yeah, that's another year of training. That would be for me. But that is everyone asks me.
Yeah.
And I have patients that are like, I need you to do my boobs. I'm like, I've never done that before. They're like, I don't care.
Oh my gosh.
I'm like, no, I only do things that I've been certified and trained in.
Yeah.
Always patient safety above all.
Right.
And then also dealing with a patient that is going through an emotional change.
Right.
I always gauge if they're mentally prepared to go through this procedure.
That's a really good point. I didn't think about that, but that's definitely like a thing.
I do not say yes to everybody.
Right.
If you're not mentally there, one, you will have poor healing.
Yeah.
More complications.
Right.
And after plastic surgery, there's a point where you have the blues.
Yeah. Dr. P, why did you let me do this? I mean, again, not that I've had anything done.
So you have, and I don't want to contribute to already a person that is in a dark place and put them in a darker place.
Right. That's so true.
It's my responsibility as a physician to not do that.
Yeah. I really hadn't thought about that, but that's like such an excellent point.
But I could tell when someone's ready.
Right. Yeah. So I was just reading this morning, like kind of in preparation for you coming here today, and I didn't even know this was a statistic, but one of the statistics I read this morning was 80% of women, and we'll talk about women versus men in a little bit, but 80% of women that get cosmetic surgery that are married report improved satisfaction in their marriage.
Yes, that is true, because they feel better.
They feel better.
They're going to want to have sex with the lights on.
Yes, yes.
And it just provides more
I wish
intimacy.
my cup said hashtag lights on. Dang it, missed opportunity. I know. Okay, all right, let's change it. I need my pen. Hold on. Are we going to edit this out? Where's my pen?
Why would we edit anything out?
Okay. Lights on. Okay.
Yeah. There you go.
That I like. Okay. Yes. I mean, they were both good. Junk in the Trunk was so good, but
what's kind of funny, I find a lot of my patients get dropped off by their husbands and picked up, that the husbands are not happy that their wives are having the procedure.
Oh, okay.
Until after.
Yes.
They see the results.
I could totally see that.
They're always like, you look fun the way you are. They probably don't want to spend the money on it.
Right.
But my motto is invest in yourself.
Yes. Yes. That's what your cup says. Yes, because probably the husbands don't realize what a positive effect it can have, not only on the wife, but like on the relationship.
On the relationship. It's huge.
Right. That's so interesting. Huh. Okay. So do men also come to you for a treatment?
So I would say the percentage of males versus females in the practice is, I have about a 10%.
Okay.
When I first started, it was 0.
Yeah.
And a lot more men are coming because their wives are bringing them in.
Okay. Yeah.
And girlfriends. And then once they have the procedure, most common is Botox.
Okay.
Once they have the procedure, they're like, wow, why have I been waiting all this time?
Okay.
Because there's a stigma attached to it, right?
Yeah.
That, oh, this is for women. Like, what are you doing this for?
Yes.
So
once they get it once, like, are they repeat customers?
Oh, yes.
Yeah. That's so funny.
And then they start wanting more and more stuff, more than the wives. And
Oh,
I'm like,
really?
this money's for her.
Yes. Oh my gosh. Interesting. You and I've kind of like talked about this a little bit before, but you know, you're a mom, you have kids.
Yes, I do.
I'm a mom, I have kids. I have 3 girls. And one of the things that I don't know if struggled is the right word, but really like have thought a lot about and wanted to be thoughtful and intentional is like how, you know, I'm big on like acceptance and body positivity and all of those things and like accepting yourself the way you are, the way God made you, you know, but then it's like as the mom, if I'm getting, you know, we'll call them enhancements, you know, how do you kind of reconcile that with your kids? Like, is that something you've thought about?
Actually, recently, yes, because I'll give you an example of things that have come up. Before I hadn't. My children are 9 years old.
Because you have twins.
Yes.
Yes.
I have a boy and a girl. And before, I never even thought about it because they never brought anything up.
Yeah.
But as of recent, my daughter has started saying things that I'm like, why are you saying I don't want to be fat? Or why are you? And she's a stick.
Yeah.
And or oh, do I need Botox? And I'm like,
gosh.
wow, the things she just like, I don't say anything to her,
Right.
but the things she's exposed to,
Yeah.
I'm like, I need to explain to her that you're beautiful,
Right.
as you are, and these are for us as we're older to help maintain the beauty that you have now.
Okay.
And go back to where we feel good and confident.
Right. Yeah. So that's.
So I'm struggling with that a little bit.
Yeah, I think it's hard because you don't want to be like hypocritical, but also you don't want you don't want to be dishonest about it. I mean, it's easier when they're little; they don't know the difference. But as they get older, and you know, they kind of like see what's going on in the world. They see what mom is doing or whatever.
And then what I noticed for myself. I'm very self-deprecating.
Oh.
So at home, let's say I'm like looking at myself, I'm like, and I don't realize you think they don't listen or
But
hear. They're on their
pick up on
iPad.
everything.
I'm like, oh, I look so fat, or oh,
Yeah.
you know, and I need to stop that talk.
Right. Yes.
I don't want her to get an eating disorder or anything like that.
Yeah.
So it's put a light on things for me that I really need to work on.
Yeah. Yeah, I remember, and my mom still does it. She's like that too. And I'm like, Mom, stop. Like, you're beautiful. Like, you're the cutest, 70-year-old I've ever seen. But like, she always did that growing up and does it now. And I'm always like, stop it, Mom. Like, but I just think like
What effect did it have on you?
Well, I don't think it gave, like, I don't think that I do that. But, sometimes we think we don't do it, but like, we don't realize we do it. So I don't think I do that, but I always like, it made me be like, Mom, why are you saying that? Like, don't talk, don't talk about yourself like that. I mean, like, I kind of do a funny thing when my kids say something like bad about themselves. I'm like, stop talking about my friend that way.
Right.
Like, you're talking about my friend that way.
Exactly.
So I think maybe it just made me more aware of that.
For sure, more aware. I agree. Like the pendulum also, I feel, has swung with this generation completely the opposite way, where we're just praising kids for putting their laundry away.
Right. For the bare minimum.
For bare minimum.
100%.
So like when it comes to their appearance, my goal for my children is for them to be healthy.
Yes.
I not their weight, but eat healthy, exercise, have a healthy mindset, because healthy body and you have a healthy mind.
Yep.
And to just be pretty confident and do their best.
Yeah.
I'm not okay with accepting yourself being
true.
not
doing your
your
best. Yes, that's true. That's a good point. Yeah, it's not just like, okay, full acceptance across the board. It's like, no, you got to show up as your best self.
Like, here's an award for brushing your teeth.
Yes, I agree. That's an excellent point. Like, we've gone so far the other way in
just
trying to
finding
build
a
up their
happy
self-esteem.
It's so hard to be a mom,
a
working mom.
Yes, that's true.
I have to, that mom guilt.
Yes.
I love working.
Yes.
So it's really hard. I don't love being a mom. I don't. It's like I'm not one of those moms that wants to go home and bake a cake and go to PTA. And no, I rather just be working until like late at night. I just enjoy it so much. Yes. But I really trying to find that balance. I hate when people say you can have it all, but not all at the same time.
Not at the same time. Yeah. Yeah, for me, it's not that I don't love being a mom. It's that I don't find my identity in motherhood.
Correct.
You know, like you see a lot of like, oh my God, I was born to do this. Like my kids are my life. Like I don't feel that way. And sometimes I'm like, should I feel that way? I don't know.
Don't you feel bad about that?
Yes, sometimes. But that's just not my identity. That's not my sole purpose on this planet. Hopefully I'm like the best mom to them, you know, as possible. And like I strive to do that and to be that, but it's not like it's. I
guess
not
that's
who I am as a
better
person.
way of saying that.
Yeah,
which makes sense because you're a lawyer, so you know how to say things.
I know how to craft sentences.
Yes, very, very well put. Very eloquent.
Yes, yeah. But I think, you know, the fact that you do love what you do shows up in how you do your job, because I know like you're amazing at what you do.
Thank you so much.
Yes, absolutely. And I think it's awesome that, you know, you are doing something that makes people feel so much better about themselves. Like that's fantastic.
It just feels good. And the technical part of it is what satisfies me as well.
Yeah.
Anatomy I enjoy and all that. And just transforming the patient, not to look different.
Right.
I want them to look like themselves. I'm not here to make you look different. I'm here to make you, one, feel good.
Right.
But also to look like the best version of yourself.
Yeah. So have you ever had someone come in and request like something crazy? And okay, tell us a story. Like what, or I don't know, share what you can.
I'll give you an example.
Okay.
So most common is patients come in from other practices and they've had so much lip filler.
Yes.
Which is what gives actually filler a bad name, is these people that walk around
like
looking
the duck lips, like
fish
crazy.
or,
Yes, or a fish. Yeah.
And they're like, oh, I need some more filler in my lips. And I'm like, you mean you need to take some out of your lips? So I don't do anything that I feel is unsafe or that I'm not comfortable with.
Yeah.
Because your face is my brand.
Right. Ooh.
So
that should be your tagline.
So all my patients are my walking billboard.
Yeah, that's why you're like, Holly, let me do some more to your face. Like, we got to fix some stuff here.
And with medicine in general, nothing goes perfect. The human body doesn't always behave as it does in the textbook.
Right.
So what I think is important is knowing how to address the complications that occur and making sure your patient is overall safe and happy.
Yeah. Yeah, absolutely. So, and you have expanded Manhattan Beauty Project, right?
Yes.
Okay. Tell us where your offices are.
So I have an office in Costa Mesa, border of Newport, that we opened. Actually, we're coming up on 2 years, which is very exciting. It's so exciting to be by the beach and never get to go to it.
Because you're in your little dungeon working all the day.
Luckily, that office has a beautiful window, so at least we get some sunlight and we can smell the ocean air.
Oh, yes.
Which
so
rejuvenates
close,
the
yet so
spirit.
far. Yes.
So that was very exciting when that happened. And then we are expanding to Dallas, Texas, which is super exciting.
Yes.
We went out there as a team. I feel like time flies, last year or a year and a half ago, and we found the perfect spot, and they're building it out, and hopefully by the fall we will be there.
Okay.
And we're moving our Canyon Lake location to a larger space to accommodate all our equipment and just provide a really elevated modern space for our patients, because we love them.
Yes. So if people are interested in having you treat them, like how can they find you? What's the best way to find you?
So the best way to find me is you can go on manhattanbeautyproject.com or on Instagram and on Google, on Yelp.
Yeah. Okay.
There's lots of different ways. And the name comes about because I grew up in New York.
Okay, yes.
So a lot of people come in, they're like, "Are you from Manhattan Beach?" And I'm like, no.
The real Manhattan.
I'm not. I wish I. So I grew up in the Bronx, and Manhattan to me always was a place where there was sophistication. Everyone was so educated, dressed well, like something I wanted to achieve.
Right.
So I really loved bringing a part of me to my practice.
Oh my gosh, I love that.
So that's how that came about.
Okay. And I totally meant to ask you at the top of the show, but I forgot. What made you want to be a surgeon in the first place?
What's kind of interesting, I went to a medical school thinking I was going to be a psychiatrist.
Oh, okay.
I thought I was going to be a psychiatrist on the Upper East Side, dealing with the well-to-do ladies of the Upper East Side.
Oh.
Like if you've seen the Swans of Capote's The Feud, those women.
Okay.
The socialites.
Okay, yeah.
And just listening to them and helping them deal with all their depression and stuff.
Yeah.
And then I went to medical school. The first class was anatomy. And I first thought I was going to be so grossed out by the cadaver.
Okay.
But then they have you in a group of 4. I seemed to have like nudged my way and was doing all the dissecting and just got entranced by it.
Really?
Yeah.
Okay. So then why orthopedic surgery?
That's another interesting story because I thought actually I was going to want to do plastic surgery, which is kind of a full circle that has come about. So when you're in medical school, your third year, you go to the hospitals and you rotate through different medical fields to see what you would want to practice. So I was going to do general surgery, and then there was another student that was doing general surgery. So they were like, okay, for 2 weeks, you can pick a subspecialty to follow. And I was like, oh, do you have plastic surgery? Like, no, we don't have that available, but we have urology or orthopedic surgeon. I was like, I don't know. I was like, what do you think I should do? She goes, well, you know, the doctors in orthopedic surgery, they're really cool and nice. And I was like, all right, fine. So what ended up happening was they were all cute.
Okay. Was your husband one of them?
No,
okay.
No, I didn't meet him till I went through a few other orthopedic surgeons.
Okay.
So I must have had a type.
Yes. If you're not an orthopedic surgeon, you got no chance at Dr. P.
It's kind of interesting. I can meet a physician and I'll know what they practice.
Really?
Different personalities go into different fields. Okay. Orthopedic surgeons are very down to earth. And cool.
Yeah.
I could
see that. Normal. Yeah.
Not so cerebral.
Right.
And we're smart because you have to be to get into orthopedic surgeon, one of the top residencies that's difficult to get into.
Yeah.
But we're kind of like, I don't know, the cool kids, I guess you would say.
I could
but
totally
it's mostly,
see that.
There's only 10% of females in this country that are orthopedic surgeons. So I was a minority in that, but it was kind of cool because at that age, I was excited to get attention.
Yeah. Well, at any age, really.
And they were just cute and fun. Yeah. It was like fun, even though we're working from like 4 a.m. to 11 at night and doing it over and over again. It was exciting and I wasn't tired.
Right.
The dopamine
because you
rush.
loved it. Yes. Yeah, totally.
Like and I had no idea how to use a hammer. I had no idea how to use a drill. I had to learn all that.
Oh my God, wait, you use a hammer and a drill when you're doing surgery?
Yes.
Really?
And screwdrivers.
Really?
Yeah.
Oh my God, you could probably also build a house.
Yes, it's like carpentry.
Wow. Oh my gosh, that's crazy. Mm-hmm. Wow. Interesting.
Yeah. So that's how that happens.
Yes.
Just cute boys.
Okay, well, on that note, thank you so much for being here today. This was really fun and very interesting.
Fun.
I learned so many new things about you.
When can I come again?
I know. Part 2.
Oh, yes.
Coming soon.
Thank you so much. Have a great day.
Yes, you too. I've got more to say. Beauty comes from within. I think we all know that and understand that. But sometimes you need a little help having your outside match how beautiful your inside is. Be sure to watch the episode, like, comment, subscribe, and never forget, you were made for more.